Dr. Emer, you're live.
Hey guys, it's Dr. Emer. Normally we're coming live to you with sculpting on Fridays, but we're doing a lot of facial sculpting these next few patients in a row because everyone's getting ready for the holidays. They want to look their best before the end of the year. My patient, you will never guess his age, and I'm not going to tell you, already looks great. We did some contouring not too long ago, and now we're just going to do a little touch up and get him ready for the end of the year into next year, because the fillers that we typically do on him will last at least a year to year and a half. We're using Radiesse and a couple other hyaluronics to sculpt and sort of define. If you guys take a look at his face, he naturally has some laxity that people will get as they age, but adding some volume that we did in his lateral part of the cheek, jawline, and chin really helped overall contour him. He also has some heavier folds, which people will get as time goes on, so we want to soften those. So we're going to use Radiesse first to address some of the volume discrepancies with exercise and some peptides. So he lost a little bit of weight. His lateral contour looks amazing, but I'm just trying to just kind of balance it. His one side of his face was a little bit more sort of heavy and droopier than the other. And so by doing this sort of more medial shaping, we're going to get a lot more lifting. You could see even the fold has improved. We're going to switch sides. And even though before I did all this lateral lifting, now I'm focusing more on the medial part of his face, because that's where we really want a little bit more volume at this point. And I'll take a look in a second once I balance. Although I will say I do like when he has a little bit more lateral contour. I feel like it slims his face and it gives him less of a round look and more of a squared look. And so I might do like one or two pokes here like this, just to kind of balance that apple of the cheek, even though that's not as much. It depends on the person's facial shape. So for him, I think a little bit on the apple and a little bit laterally would actually look really good. And that will give him some lifting and some sculpting to make him a little more defined. The other thing we always do, where is the main area, you guys, that we always address in male facial sculpting?
Chin jaw.
Exactly. So let's go to the chin. And I think his jaw actually looks great. Long term, we'll do some other things for the neck, lift up a little. But I want to give him a little bit more here because he has really nice lips. We've done a really good job initially building this out a little bit more on the bone. Will give him more of that projection that I was looking for. So especially from that 90-degree angle, which I'll show you guys in a second. You can literally watch it rise. You could see it sculpting a little bit there. I'm going to come in there, just hold pressure there. I'm going to switch sides. And I really want to give him a little bit more of that projection and sort of squared off look, because it's really going to make him more shaped. And like everyone says, I feel like chin is like the biggest impact for people. I know in this room, we have a couple of people that have gotten chin filler and how much they love it. At some point, I'll need it. You guys see, like even that, just that alone, even improved his neck, because that projection and that shaping lifts everything up. I'm going to come on this side, just kind of go towards one area that's heavy is when the marionette line, which is the corner drooping of the mouth, becomes heavy. So we're going to treat that too. But look at that difference, just that one syringe. Look at it. Now it's in line. Love the lips. Love everything here. So that's going to look really good. So now I'm going to do is go over and balance now what we just did with the chin. I want to improve the corners of the mouth. And so this will help sort of this area right here. I call this kind of the windshield wiper, or the bow tie. We could treat both of those. And I teach about this at Emer University when we do fillers and laser training. But here's the thing. This is a technique. It's not as commonly used, I would say, in the US. Look a little left for me a little bit. Perfect. But it's a really, really good technique. One, for safety, because we're using a cannula. And that limits any bruising, swelling, or issues with the nerves and arteries around here. But also, it allows us to improve not only the crease of the chin, but also that angle like to the side of the chin that we want for that definition that we want him to have. So we're using that cannula to go right on, just literally drawing a line right there so it looks more defined. Perfect. So you guys see, like right here. Now look at the softening of that fold. And look at more of that balancing now. Look, the corner, look at almost no shadowing, and here there's shadowing. So now let's get this shadowing right here. So we're gonna do that same thing with the cannula. And I like to use a softer HA, although with him, because he has thicker skin, we're actually using a thicker HA. So normally I'm using something a little bit softer. And remember, this is a tweak. This is not, you know, he's already had treatment done before, so he's going to look enhanced but not different. And that's the key. We just want him to look real good, but I don't want him to look like anything was done. So again, I'm just kind of doing his windshield wiper. I'm going across in multiple levels. Hold on, I'll go grab a little bit more, and then we'll switch to the eye. Just going to use a little more HA, a little extra. It's a different filler, but it's okay. Just want this to be a little more. I feel like he'll look better with us having a little bit more volume right through there. Perfect. Okay. So now look at that contouring along the jaw and the chin. And so now I'm going to go to his under eye. And that's an area that bothers him. And there's a couple ways to do it. I feel like doing the cannula for him will be safer. He has thinner skin, so you don't want to overdo it in this area. He would do great doing a surgical bleph or laser, but we're just going to do a little bit. Look at that needle again. Trying again, address all this using the cannula. He's going to love it. I can tell. It looks really good. Sometimes pores and scars. Okay, give me that needle again. I'm going to have to switch the location a little bit. Okay, now go ahead. All right, let's do that. There. Okay, sometimes that happens. The cannula entrance. Okay, so we're just using a little bit of the filler, not too much, to just go directly under and just do a little bit of volume. You don't want to overdo it because it's going to look overdone if we do. And again, just more of the medial area up through here. Long term, if we want to fill out a little more, we can do to the lateral portion as well. And again, we're just literally, look, you can see exactly where that cannula is. What do people normally ask you guys about under eyes or any of these facial sculptings?
Puffiness on the under eyes, be able to see it.
Yeah, sometimes it takes a few weeks for the swelling to go down. And also sometimes you can't fully get the under eye improved. Look, he does have eye bags, but we can soften it a little bit. And then the last part is we're going to do a little to the fold and just kind of soften the fold, because that is going to give us, again, more support here to lift. And so long term, we need to go a little laterally on the eye. I just wanted to focus on the medial portion.
Can this also be combined with neurotoxins around the eye?
Oh yeah, of course. So we can do that. That would be more for wrinkles, not for hollows or color. And again, it can be used with lasers. You could do plasma pen for tightening for color. And long term, we can do a surgical lift. Surgical bleph, you know. So I really want to get this piriform area and get this fold. There we go. So now look at the difference in the softening of that fold. Let's switch to the opposite side, and then we're going to finish. And I think this is a really nice enhancement, especially since he has some facial laxity that now honestly is really improved. And the heaviness that you saw in the creases, look up a little bit into your right. The heaviness that you saw in the creases of his folds and his lip are now gone, and his cheek looks more defined. He'll be ready for the holidays. He'll look great. Amazing. And again, we're going down different layers here. First, I'm going down to the bone, to the piriform, to give a little bit of support here and lift. It even helps the lip. And then we're going to come back, come up a little bit more superficial, and address the actual surface subdermal layer to help the actual deep fold. Perfect. So now we can do an Emer reveal. Let's do an Emer reveal. This is the fun part, where he's going to showcase how good he looks. Take a look, grab the phone. I want you to, no, you grab the phone from them. Keep your face up like it was, because that angle is good. He's going to flip that around. You just hold that a second. Go ahead and hold that. Hold that. Take a look at your face. He looks like John now. Yeah. Looks like John. He's so sculpted. Look, what do you think?
I like it.
So there's a little bit of swelling, obviously, always on the under eye, but look at more contoured here, more built out here, softened here, softened here. I think
I look younger.
Yeah, I mean, you look really young, to be honest. No one would ever guess your age. Long term, we could do the outer part of the eye. I didn't do that yet. I just focused on the middle because I wanted the bags to be improved. But overall, look at that contour. Look at your neck and jaw. Look through here. I think it's amazing. What do you think?
Yeah, I like it. Thank you.
So you wanted to look younger.
Yeah.
And what else?
And feel better.
And feel better? What do you think?
Yeah, I feel better now.
Okay, good. So he's more youthful. So take a look in the mirror here. Get the bigger one. Why not?
Yeah.
So now, Chuck, be careful. It's heavy. I don't want it to fall on you. But what do you think now?
Yeah, I like it.
It looks great. I think it's a perfect touch-up, and it doesn't look overdone.
Mm-hmm.
That's the key, especially with men. Let them show your face. Especially with men, you guys, we want it natural. We want it to look sculpted, and especially if somebody's losing weight and we're trying to keep their face defined and sort of not falling, this is a good sort of touch-up areas to get that lift, to get that contour and the softening. So that's male facial sculpting enhancement procedure.